see now. Hi everyone. Good afternoon. Welcome to this session. You keep it shut. तो वो echo आ रहा है. Welcome to today's session about 5 ways how you can make your core strong. Please let me know if you can hear me well and if you can see me well, and also if you can see this PPT, because the slides will be here. We will be doing a little bit of theory about the core and then we'll do some practical stuff, right? So everybody who is here online in the group, please do not put any comments on YouTube. Put the comments in the group. You're all in the group. Put it in the group. Tell me if you can see me and hear me well. Do it now so I know that I can start. You can keep it that. Okay, so let's start today's session. How many have joined? Just tell me that. Okay, take it. More people will join. We have this session is hybrid, which means that you can attend online as well as offline. This workshop is for the people who have registered for this workshop. I don't want you to share this link around because this is only for you because you've registered for it. This session, the way that I'm going to teach it, the way that I teach core or any workshop really, we will go through the slides. When you think of a question, if you have a question, I don't want you to wait till the end. I want you to put it in the WhatsApp group because that's where I will look at it later and I will answer your questions. There is also Dr. Bhumika here who is going to help me answer your questions. So when a question comes in the group and I feel we can take it right away, I will. Okay, but definitely put the questions in. And congratulations for wanting to make your core strong, because I believe this is one thing that can really change your life if your core is strong and if you work on your core the right way. Before I start, some of you already know me and some of you are new here. So if you are new here, I want you to put new in the group so that I know how many new members have joined today's workshop. New meaning you've never attended a workshop of mine before, that you don't know me yet. Put it in the group right now. Okay, so I guess a lot of people have already attended my workshops. So before I start, let me tell you a little bit about myself. I'm Dr. Rajni Patil. I'm a spine and sports physiotherapist. I specialize in spine and sports. I have about 23 plus years of experience. When I first started my practice, it was in the US. I lived and worked and studied, did all my master, my DPT, everything I did post-grad in the US. I was there for 10 years and I picked up a lot of valuable advanced stuff that I then, when I came back to India and Mumbai, I apply that now, right? So about 23 years of practice, and I do a lot of preventive stuff, which is why these free workshops I hold, because I think that a lot of pain can be prevented. Everything that's happening, back pain, knee pain, especially if you're an athlete, you know that pain is part of your life. So you have to make sure that the foundation of your body is strong, and that brings me to core. And in all these years of my practice, I have seen that core is so misunderstood. And this is not just lay people, it's athletes, it is trainers, it is sometimes, even doctors who don't quite understand what the core really is. And hence people end up injuring their back. So because I treat so much spine in the clinic, which means neck pain and back pain, बहुत बार ऐसा होता है कि deadlift किया, pain आ गया, crunches किया, pain आ गया. And then sometimes they are big problems like disc issues हो जाएगा. फिर उसको treat करते 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 it takes time, right? So that's what I don't want for you. I want you to do your core training in the right way. So if you're new to my community, I have a WhatsApp forum, which is a health and fitness forum, but I also have separate forums for runners and cyclists, because these are the two groups of athletes that I work with closely. And running is my passion. We treat runners a lot, and we do a lot of preventive stuff for them. So if you're a runner, if you want to be in this forum, please ping me. I will put you in the group. So let's get started. I want you to tell me first if you are right now working on your core, if you're doing any core exercises. If you are, I want you to tell me what are the top 3-4 exercises that you are doing. If you have worked on your core in the past, and if you had an injury from it, I want you to tell me that also. Put it in the group now, please. I would like to take a look at it. You can see, na? Oh, you can see me. Na, हाँ तो वो. You've not opened. Open and see. लिंक खोल के देखो, दिख रहा है. हाँ तो वो उसका नेटवर्क होगा. You'll have to read the comments. Guys, a lot of you are putting comments in the YouTube live. Don't do that. I will not be able to address it. I want you to put it in the WhatsApp group that you're watching this from. I said this in the beginning. I'm repeating it again. Do not put comments in the YouTube live. Bhumika, you'll have to help me with the comments because I can't see. Even here. Please put your comments in the group. If you have done core workouts before and you've injured your back, I want to know about it. If you are working on your core, what are the top 2-3 exercises that you're doing? Put it in the group, please. You can see now properly? Yeah. Okay. Okay, so Pilates. Okay. So it looks like there are 2 types of audience here. Ashi? Chair, sir. Okay. One is the type that probably has not worked on the core and you want to do it now and you want to do it the right way. That's great. This is a great place to start. And there might be another set who you put some comments that you're doing crunches. Bhumika, tell me what are the main exercises? Crunches, planks, Pilates. Leg raises. Okay. So, over all these years of practice, these are the exercises that most of my people say that they're doing. Crunches, planks, leg raises, Pilates. Pilates is fine, but these exercises, I know that these are the common ones that people do. But the fact is that when you do some of these exercises, one, you are putting your lower back at risk. Okay, crunches directly create a lot of pressure on the back. That's point number 1. But the point number 2 is that crunches only work one muscle. And can you guess how many muscles are there in the core? What do you think the core is? So tell me in the group, what do you think the core actually is? What does the core mean to you? Put it in the group, I want to know. Is that Shraddha? There is a physio attending. He's our athlete. Guys, do not put it in YouTube live. Again, I'm telling you, I will not have access to those comments later. Okay, so tell me in the group. Bhumika, read. वो उसका नेटवर्क इशू है.
Glutes back of these.
Okay.
Front and side and back muscles.
Yes, most likely that's okay. All right. So some of you have answered right, but the biggest myth that exists is that abs are core. Okay, and that's the biggest myth of all. And I want today from this session, if you take nothing else, I want you to take away the fact that there are so many muscles of the core. And I'm going to show you a few photos here so you can connect with that, right? So you can, okay, Badu? Yes, already told you about it here. These are the three top myths. One, abdomen is the core. Most people think that this area is the core. It's not. If I tell you अपना core tight पकड़ो, क्या करोगे आप? पेट को अंदर खींचोगे, है ना? Most people will do that. But there are so many other muscles. What about that? जब हम spine को एक तरफ से load करते हैं, दूसरा side भूल जाते हैं, which is the front को हम load कर रहे हैं, exercise कर रहे हैं, workout कर रहे हैं, लेकिन हम sides भूल रहे हैं, हम glutes भूल रहे हैं, हम back भूल रहे हैं. You're not looking at the whole core. You're only looking at one aspect of the core. That's the biggest myth, and this is what creates most back pain. Slip disc, even neck pain, because crunches may a lot of neck pain also starts to happen from that. So six packs, the second myth is six pack. So running after a six pack, somebody who is sedentary, not doing much, एक दिन suddenly उनको motivation आएगा मेरे को तो six pack बनाने का है. First thing what they'll do, start doing crunches. In 5 days, back is gone. Six pack तो दूर का, अभी back का treat करो. Okay, this is reality. I'm telling you reality. Crunches, another big myth. So all types of crunches people do. Oblique crunches, leg crunches, whatever. All kinds of stuff. There is a video specifically I have made on what I think are the worst exercises, core exercises that you should be doing. I will share that later, but deadlifts, crunches actually tops my list. Okay, if you are doing planks, that's okay, but please understand that planks, if you're not doing that right and if you don't have the foundation, then that's not going to help you either. You're doing that plank is probably 10-20% effective. आप पूरा core शायद use नहीं कर रहे. Can move on. Okay, that's a big one. Who here has had back pain? Put it in the group. Yes, say yes if you've ever experienced back pain. How many yeses have come? You put yes. Bhumika, talk to me.
It's like all of that. Back pain when I wake up in the morning. Back pain when I wake up in the morning. Yes, back pain. Yes.
Okay, so what does medical science, what do statistics tell us? 80%, more than 80% of back pain is coming from a poor core. If you can make your core strong, then your back pain will go away. Of course, you might need some treatment to get you to the point where you can do core training. And you have to make sure that you are not following all these myths. खाली जाके फटाफट जाके crunches करोगे. If you go and do crunches today, your back pain will definitely get worse, right? So you have to be guided by a professional, which can be a spine physiotherapist who knows the spine really well, or a trainer who actually knows anatomy well, right? Somebody who's experienced. You can go on.
After a long ride, I have a back pain.
Okay, yes, we will come to that. So, what is the core? Please look at my slide. Can you see my slide? How many muscles make up the core? Most people think that this is the core. इधर कितने muscles हैं? 3, 4, 5, बस इतना ही है इधर. बाकी सब, what about all the rest of the core muscles? There are about 29 sets of muscles, pairs of muscles. Okay, 29 pairs of muscles that make up the core. And this is reality, and this is what people don't know, and that's why they're injuring their back again and again and again when they're trying to do core training. So, Your core muscles are the foundation of your body. Foundation मतलब क्या? अगर ये पार्ट आपका स्ट्रांग है, अगर आपका कोर विच इज द मिड सेक्शन, थिंक अबाउट ओल्डर डेज में आप यूरोपियन वुमेन यूज्ड टू वेयर द कॉर्सेट्स, यू रिमेंबर दोस, राइट? सो द कॉर्सेट एरिया इतना पूरा जो कवर करता है, अगर ये एरिया हमारा रॉक सॉलिड स्ट्रांग है तो आपको कोई इंजरी कभी नहीं होगी. इनफैक्ट एवरी पेशेंट हु कम्स टू माय क्लिनिक, once I make their pain a little bit better, medically I'm treating them, then my end goal is to make their core strong. Because if I discharge them before making their core strong, the pain is going to come back. It can be shoulder pain, it can be neck pain, it can be knee pain. How many knee pain patients thoda treatment karke, but the minute I start making their core strong, the knee pain vanishes? Why is that? Okay, there's a huge correlation between our core muscles, our spine. Our spine has to be strong, right? ये अपना बैकबोन है, ये हमारा बैकबोन के आसपास आपके कोर मसल्स है. अगर ये अच्छे से स्पाइन को पकड़ के रखेंगे, स्ट्रांग बना के रखेंगे, तो हिप पेन नहीं आता, नी पेन नहीं आता, फुट पेन नहीं आता, कुछ नहीं आता है, राइट? हैव यू अंडरस्टूड दिस little part? How many muscles in the core? Yes, pairs of muscles, 29 pairs of muscles.
Does core training or exercises help both abdominal or visceral fat?
Okay, I will take that question later. I will take all the questions. Please don't think that I won't. I will answer all the questions. But let me get through this PPT. So are you with me so far, guys? Yeah? Let's go to the next slide. Okay. Look at the anatomy of the core 1 minute. I want you to take a look at this slide carefully.
I'm asking you.
It's okay. Okay, so these are all the muscles. Let's break this down थोड़ा सा और. You see how many front में जितना है, sides में जितना है, उतना ही back में है. आपके lower back muscles भी core में आते हैं. आपके glutes, these are the big muscles. Side glute, these are big muscles. अगर इसको हम strong नहीं रखते हैं, absolutely the load पूरा low back पे आएगा. Everybody with back pain or a history of back pain, I want you to think about this today. One. Okay, this is all the muscles. I don't want to get into so much detail, but these are all the muscles that make up the core, right? So also your diaphragm is your primary breathing muscle. यहाँ बैठता है वो. So when you do breathing, that's also a core muscle, by the way. Nobody thinks about that. So जब आप क्रंच करते हो, ब्रेथ होल्ड किया, प्लैंक किया, ब्रेथ होल्ड किया, डायफ्राम तो आप भूल गए क्योंकि डायफ्राम फिर यूज ही नहीं हो रहा है, राइट? यू हैव टू यूज योर ब्रीदिंग आल्सो इफेक्टिवली व्हेन यू आर डूइंग योर कोर एक्सरसाइजेस. गो ऑन. Okay, now even in the abdomen there are so many muscles, but when you're doing crunch, go to the next one. When you're doing the crunch, you are only working your rectus abdominis. Here थोड़ा साइड का मसल्स होता है, but the reality is अगर आपने आपके मसल्स को एक्टिवेट नहीं किया है, the foundation is only not there. If they are starting from zero strength और आप crunch कर रहे हो, that means कि उसमें वो capacity ही नहीं है to do that exercise, which means this is how our body works. अगर एक मसल काम नहीं कर रहा है, मूवमेंट हो जाएगी, पर कोई और मसल काम कर रहा है. So here in this case, you can guess what muscles are working. Your shoulders, your neck, your chest, all this is working hard to bring you up. Your hip muscles, everything is working, पर core कुछ ab तो कुछ काम कर ही नहीं रहा है. This is the reality of a crunch. Unless you have done a lot of activation and foundation exercises, that is reality of a crunch. Okay, now if you are not thinking, if you are not working on your core, then these are all the things that happen. They are all directly connected with a weak core. So, right, knee pain, I told you. Back pain to sabse bada hai. Anybody here who's never had back pain? Put it in the group. Never likho. Never experienced back pain in their life ever. Radio silence hoga because everybody has experienced back pain at some point of their lives. I want you to tell me if you have done crunches before and you've experienced back pain after that. Put it in the group. Crunches if you've had back pain after doing crunches. Back pain or even neck pain, by the way. We can go up. क्या आया comment? That's okay. Keep going on. So here's the reality. Whenever you do any exercise for the front of the spine, you must do some for the back. समझो आज आपने बैक वर्कआउट किया है, सब अपर लोअर बैक अपर बैक ये सब आपने वर्कआउट किया है. अगर आप फ्रंट को भूल गए तो दैट इज पुटिंग योर बैक एट रिस्क. अगर आपने आज क्रंचेस किए हैं और आपने बैक को स्ट्रांग नहीं बनाया है, दैट अगेन इज गोइंग टू पुट यू at risk. So what do you need to do? You need to do a balanced set of exercises, not just one type. And obviously, because I have seen this so much, and we have one participant here who has actually done my BBC course, which I did in COVID time, right? In COVID time, I was teaching Bulletproof Back and Core course. This is a 10-session course. And I taught it all online during COVID. Okay. And from there, a lot of great feedback has come from runners being able to push, they do great, people who were cycling who did great because they were able to do, because they had worked on their core in a very scientific way. So there is one patient of mine who had knee pain. And his dream was to run a full marathon. In fact, his doctor had told him कि X-ray, MRI सब करके हो गया था कि आप ट्रैक बंद कर दो, आप साइकिलिंग बंद कर दो, आप रनिंग बंद कर दो, आप सब कुछ बंद कर दो. So I said, no, that's not the way to live. You have to do what you enjoy doing. So he did BBC with me, which is the Bulletproof Back and Core program, 10 sessions. And of course, he very consistent and very sincere and did it wonderfully. Okay, so after that, he started running and he completed a full marathon last year. And this is not just one person. There are so many people who, if they get the correct guidance and if they work on their core in a very structured manner, then it makes a huge difference. Instead of एक कल plank कर लिया, 4-5 plank कर लिया, squats कर लिया, anything like that, that's going to really mess up. खिचड़ी पक जाती है core की, right? So that's what we don't want to do. Here are the 5 exercises that you are using and abusing. So if you can't read the slides, I'm going to read them to you. Squats. Most people think that squats work on the core and they think that it works on the glutes. How many of you think that आज glutes पे काम करेंगे, आज squats करेंगे, आज lunges करेंगे? How many of you think that? Please put it in the group. The reality is if you are not activating your core muscles, you're not activating your glute muscles, and you're directly jumping into a squat, trust me, your glutes are sleeping or they are half dead. I used to say dead butt syndrome. There is actually a syndrome like that where your glutes just on fire, not in sitting, not in walking, not in standing. So when you do a squat, what are you doing? You're only working your quads. Our quads are great to work, that's fine, but is it a core muscle? No. Glutes are your core muscle. It's the foundation of your core. So squats में कुछ नहीं होता है, glutes work नहीं होते. If a clue should be, if you are getting a lot of glute soreness after doing squats, congratulations, your glutes have engaged during the squats. But if not, then no. Second one, lunges. So same thing. Squats, lunges, sit in the same bracket. Okay. I'm not saying you should not do these exercises. What I'm saying is you should know the truth of these exercises. आप अगर अपने quads build करना चाहते हो तो definitely squats and lunges करो. पर ये मत सोचो कि इससे आपके glutes strong हो रहे हैं. Planks. Planks are great. Side plank is actually more superior than a regular plank. But planks, most people are doing it wrong. They are not engaging the glutes at all. They are not engaging any muscle. Movement तो हो जाएगी, कितनी भी देर हो जाएगी. पर muscles activate किए क्या? Squeeze करके hold किया क्या? That's how a correct plank is to be done. So it gets done wrong. Crunches, unnecessary, absolutely unnecessary. In my BBC 10 sessions, I work on every one group of muscles, and there's not a single crunch. कि जरूरत ही नहीं है. फिर भी when we do our pre-assessment before I start my course, I do a pre-assessment. We look at where your core is, what all these muscles that you saw in the anatomy, I check every single one of them. So I know where your starting point is, and then at the end of the program we recheck and all the muscles are nice and strong. And if something goes wrong, I know where to tweak it. So in fact, in March I am starting BBC again. I have not done it in a while because I don't have the bandwidth because of a busy clinic. However, I have decided to do an online, hybrid and offline. So one-to-one is with me in the clinic. Group is on Zoom. And hybrid is you do a few sessions online and 1 or 2 sessions you come to the clinic. So this is a model that I am going to start soon. However, this is not one of those things where you can just pay and you can join. No, you will do a call with me first. I need to understand your situation. Medically, is your back okay and are you ready to join the course? Then we will be taking you in. So if you guys are interested in that, please put a yes in the group. I will do a poll later and you can let me know and we'll get on a call and we'll figure out if it is the right time for you, if it is, it'll be helpful to you. Okay. So deadlift. I don't like this exercise at all. And I know there are some huge fans of deadlift. I'm sure इस ग्रुप में भी लोग होंगे जो बोलेंगे अरे डेडलिफ्ट तो करना ही चाहिए, वर्कआउट किया और डेडलिफ्ट नहीं किया तो ऐसे कैसे हो सकता है. बट इफ यू हैड अ हिस्ट्री ऑफ बैक पेन, प्लीज डोंट टॉर्चर योर बैक. Stop doing a deadlift. There are so many better exercises how you can make your back strong. आपका एंड गोल क्या है डेडलिफ्ट में? बैक को स्ट्रॉन्ग करना है और बहुत एक्सरसाइजेस है वो करो. रिस्क मत डालो अपने बैक को, डिस्क पे लोड इतना मत करो. Okay, now I said two people are here who will be getting the free assessment of the core. When we look at the core, when we assess the core, it's not just the muscle strength. It's also the muscles around the core, like your hip flexors, your QL, which sits here. All of these muscles also have to be open. अगर वो टाइट है तो आप कितना भी कोर एक्सरसाइज कर लो वो स्ट्रांग नहीं होने वाले हैं. सो वी विल बी लुकिंग एट दैट, वील असेस दैट. वो टाइट है तो पहले वो रिलीज करो, उसके बाद सब स्ट्रांग करो. राइट, that's how the effective way of working on your core is. Can you go up? Okay, so if you wanted to check your core on your own, there is a plank challenge that I will put it in the group later. The plank challenge is basically a series of exercises done in plank, and the longer your circuit is, the better you are. So some of you who want to take the challenge, I will put it in the group. Send me. In fact, we had done a contest during COVID. ही वो contest किया था. हाँ, BBC के पहले. Yes. So if you wanted to check, these are the exercises that will help you understand how great your core is. I would say you start with doing side planks. Side plank करो दोनों side पे. See if there is right and left में कितना difference है. Because if one side is you are able to hold it for say 30 seconds and one side you are able to hold it for 6 seconds, then that's a huge discrepancy. It means somewhere either your gluteus medius is not working or your oblique is not working. Okay, and you don't, how will you know that, right? Unless somebody checks that. The other great one to do is bridge with SLR. Also a very underestimated exercise. So bridge is coming up like a bridge and then keeping your legs straight. This is more of a qualitative as well as quantitative. So the longer you can hold it without your hips dropping and without any rotation, that's a great way to test your core also. Seal. Seal is lying on your tummy and coming up as high as you can. That tests your back extensor muscles. This is ultimate plank challenge, which I will post it in the group, and you guys can do it today and then send it to me, put it in the group, DM me, show me how strong your core is. But today I thought we could do go up or kuch hai? Okay, yes. So let's quickly do a core assessment. All of you do these exercises with me so that you will understand if your core is actually strong or not. I won't be able to see you, but if you want, you can do a quick video like some of my participants have done before. Place the phone in front of you and then do that, record it, send it in the group. Okay, I'll be happy to take a look at that. Now, the way that my top exercises for the core, it's not just strength, it is all of this. Okay, it's step by step. First, we start with activation exercises. Do you know what activation exercises are? If you've attended any of my workshop before, then you know what activation exercises are. But if you don't know, please tell me no. If you don't know what muscle activation means, core activation means, please say no. No, there are many no's. Ashok, are you there? You must say yes. What about you? रिविजन का टाइम हो गया लगता है रिफ्रेशर
Ashok is saying yes.
Ashok is saying
All are saying no.
I knew it, Ashok. Yes. So I'm glad. Thank you for that, Ashok. I'm glad you said that. So activation is the first step in order to build your core. And because there are so many of you that said no, I have to teach you how to activate your muscles. Okay. So activation is the first step. उसके बाद आप फोम रोलिंग करोगे, हिप पे, क्यूएल पे सब मसल्स रिलीज करोगे. उसके बाद आप कोर एंड ग्लूट का आइसोलेटेड एक्सरसाइज करोगे. आइसोलेटेड मतलब क्या? वो ही खाली मसल वर्क होना चाहिए और कोई मसल काम नहीं करना चाहिए. ओनली देन यू नो दैट इट इज एक्चुअली वर्किंग. So the problem with plank is that na you don't know what muscles are working, but when you do an activation and then an isolated exercise, वो मसल को ऑप्शन ही नहीं है, उसको काम ही करना पड़ेगा. Right? So there are exercises like that you should be doing. Those are the first 2-3 steps. उसके बाद दुनिया भर का plank करो, दुनिया भर का crunch करो. That I'm okay with. Comments? No. Okay. Okay. Okay, so that's how I teach my core. But let's get to some assessments. So let's put it down. Pull out your mats, guys. We are doing a few practical exercises. तू करशील? त्याला करू दे. तू तिकडे मॅट घालून कर. You come here. I told you are my model today. Yes. You do it there, no? It's okay. Nobody can see you. Just make sure that. So first we are doing. Let's go back to the initial assessment wala slide. Let me see how कैसा दिख रहा है. हाँ, you do it here. Go back to the assessment का slide. नहीं, ये नहीं. Yes, this. I forgot your name. Ashok.
mine is Ashok.
Okay. So we are going. Tell me if you can see Ashok and me properly, because we are doing the core assessment. I'm expecting all of you to do this with me, by the way. अगर आप नहीं कर रहे हो तो कुछ फायदा ही नहीं है. नेक्स्ट टाइम फिर मैं ऑनलाइन रखूंगी नहीं, सबको इधर ही आना पड़ेगा. Is everybody ready? Say yes in the group.
Yes.
Yes. Okay, we are starting. So I want you to first do a crunch.
This one.
Okay. Can you see him do a crunch? करो. Okay. Crunch करो सब लोग. Tell me क्या muscle work हो रहा है? Pay attention. Load कहाँ आ रहा है? Back पे आ रहा है.
Back there.
Back पे आ रहा है. Pressure back पे आ रहा है. और क्या muscle काम कर रहा है बताओ?
इधर वाला स्लाइड काम कर रहा है.
Lower back पे pressure.
Lower back पे pressure ज़्यादा आ रहा है. Okay. Now, what should happen if Ashok is going to do this crunch properly? Do it how you were doing it now. Okay, pay attention क्या हो रहा है? I can see lot of neck muscles working. I can see chest muscles working. And come up. Do you see his tummy coming up? अगर muscles ये वाले tight है तो tummy ऊपर आना चाहिए कि अंदर जाना चाहिए? अंदर जाना चाहिए. So
Yes.
ये muscle काम ही नहीं कर रहा है अंदर का. So how will you do the crunch correctly? I can't believe I'm teaching you how to do the crunch correctly. First, I want you to stop doing, but if you do, then you do it correctly. Stop. Now, first you will activate your abdominal muscles. How will you activate them? You will take a deep breath in. When you breathe in, your tummy will come up. Now, when you breathe out, पूरा पेट अंदर जाना चाहिए. पूरी हवा बाहर निकालो. Diaphragm is working. These muscles are working. Can you feel it?
Yeah.
You can feel it. Right? So now your ab muscles are activated. अब इसमें भी only when I feel each single one, like your transverse abdominis, your oblique, and your rectus abdominis, these three primary ones, if I check, I can tell which one is working and the other one is being lazy. और ऐसा भी होता है कभी-कभी कि ये एक साइड का oblique काम कर रहा है, दूसरा साइड का is going for the ride. It's not really working that well. So now you've activated it.
Yeah.
Now keep it activated. इसको अंदर ही रहना चाहिए पेट.
Okay.
Okay. So do a breathing, activate it, and pull it back in. Now come up into a crunch. Good. Did you feel that more? You
Yes.
felt that more. Was the back पे pressure come?
No.
Back पे pressure नहीं आया.
नहीं.
हाँ. So if you do the crunch in this way, you will be able to do the crunch a lot more effective. Plus back से pressure निकल जाएगा. Okay. This is one. I just wanted to show you that because most people don't even activate their abs when they're doing any exercises. So, अब हमको next करना है bridge. Let's do a bridge with SLR. All of you are going to do this with me. I hope you tried the crunch. Give me feedback about whether you understood about the activation part of the abs or not. Please put it in the group. Let me know. The next one we are going to do is a bridge with SLR. Straight leg raise. So come up into a bridge. Bridge किया, एक पैर सीधा करो. Good. अब the minute you straighten one leg, what is happening? You can feel this hip is starting to go down.
Yeah.
Correct? Why is that happening? Because the right glute is not doing a great job. The abs are not activated right now. Okay, so now this qualitatively, this would be a failed test. So if you're doing it and you think you're doing a great job, please mirror में देखो या किसी को पूछो वो hip drop हो रहा है कि नहीं. But you should have that much awareness कि exercise बराबर हो रही है कि नहीं. I believe in quality and not quantity. अगर आप plank कर रहे हो, आप 5 करो, 15 मत करो, 5 करो पर अच्छे से करो, perfect करो. So now activate. What will you activate? Abs you'll activate. Very good. Now when you come up into a bridge, you will squeeze your glutes. Glutes को squeeze करो. Now straighten the leg. Better, the hip is staying up. Okay. This is a difference when you do it. Relax. Now he can hold on much longer without the hip dropping. Why? Because he activated the muscles before he did the exercise. अब एक्टिवेशन में भी ऐसा है, सबका स्ट्रेंथ अलग होता है. Some people, one glute is able to activate, the other glute is not able to activate at all. So you have to be able to do isolated glute and ab activation, and there is a whole video on that. If you are interested, I will share that with you. If you are doing the course BBC with me, then the only thing in the beginning I will be focusing on is making sure that you're able to activate all the core muscles. उससे पहले हम आगे बढ़ेंगे ही नहीं. So then बाकी का सब फटाफट easy हो जाता है, right? The next one we are going to do is a side plank. Yeah. I hope you guys did the bridge with straight leg raise. How was it? Tell me. In the group, please let me know how did you fare? Did you do great? Did you think your hip was dropping? Give me feedback, guys. Okay, now the next one we are doing is a side plank. The side plank, go ahead, do it. Actually, let's time you guys, na? Please time yourself. Phone पे timer लगाओ. And time yourself कितना हो रहा है. दोनों तरफ करने वाले हैं हम. चलो, up and hold. You don't do. Back trigger होईल नको करू. Comments मुझे बता दे रहा because I can't see that. बस ना तो. Okay. Now you saw when he was coming up into a side plank, he wasn't able to come up very high, no? Which means that the core definitely needs some work. Have you guys timed yourself? Tell me what one side ka side plank was. Time करके बताओ मुझे. Let's do the other side. Let's do the other side, side plank, and tell me how much you're able to do. Put it in the group. Did you think one side was better than the other? This side was better. You could tell effort was less, na?
Yeah.
Effort was less. Now do that side again. This time you will activate. So we are going to do a side plank with all the muscles activated. First you will do the breathing. Pull your belly button in. Good. And when you lift up, you will squeeze your glute also. Lift, squeeze, breathe, and hold. Is he higher than before? Looks to be higher than before.
How to increase the hold time of it?
That comes with strength. Activation, when strength comes, automatically your time will increase.
I'm not able to hold and exercise.
That's okay. That will come when the strength comes. Okay, now we'll do plank. नहीं, seal करते हैं. On your tummy. Okay, now what is the benchmark for a good plank, side plank, any of the bridges? It is 60 seconds. If you are able to do a 60-second all of these exercises without your form changing, with perfect form, then that means that you have a decent core. Okay, so that's how you will test this. So if you're anything under 60 seconds, it needs work. Let's do seal. So seal is testing the back extensors. So lie down flat. Now put your hands on the small of your back. Now you're going to lift your upper body up. Your legs stay on the ground. Good. So this, there are qualitative is what? कितना ऊपर आप आ रहे हो. Second is what? कितनी देर आप इसको hold कर सकते हो comfortably और breathing करना है. Breathing रुक रही है. So again, that is qualitatively it is wrong. So test yourself, time yourself, tell me how much time you're able to do and whether you're actually able to lift up high. Now how to make this better? if Ashok were to squeeze his glutes to begin with? Yes. इसमें abs पे ध्यान मत दो, glutes को squeeze करो. Yes, squeeze your glutes and lift much higher. Squeeze here also. Very good. And breathe and hold.
Is seat good for lower back?
Yes, it's excellent for the lower back. But again, this is only working extensors. If you don't work, if you only do this and don't do the others, then again you're causing an imbalance. I hope you've understood कि सब exercises balance में होनी चाहिए. Back के muscles भी, glutes also, abs also. All the exercises have to be done in order to make it a balanced routine for you. Better, na, Ashok?
Yeah.
Okay, that's a seal. Qualitatively and quantitatively, you need to make sure that it's good. So these were our assessments. Now, while you're lying here, I want you to try to activate your glutes. What does activation mean? It basically just means that you're able to contract your muscles at will. So you're going to lie prone on your tummy and squeeze both your glutes first. Hey, tu karu Sakshi. So squeeze both your glutes. You want to keep your hands on the glutes because only then you will understand कि वो tightness है कि नहीं और कितना tight है. It has to be properly tight, not half effort, not 10%, 20% effort. It has to be 100% effort. अच्छे से squeeze करो and see under your hands if you're able to feel the contraction. You should feel it under your hands. The other thing you're paying attention is right and left glute. Are they equally contracting or is one being lazy?
Lazy.
Lazy. Which one?
This one.
Ah. Give me feedback in the group, please. Great, great. Thank you so much for sharing, guys. So if you think one is lazy, let's see what happens when you isolate it. So now you'll do only one side. Start with this side because this is your stronger one. So squeeze only the right glute to begin with. Lie on your tummy, hand on the glute, and you're going to only squeeze the one glute. दूसरा glute पे भी हाथ रखो because वो tight हो रहा है तो आपको समझना चाहिए. सिर्फ ये काम करना चाहिए, ये काम नहीं करना चाहिए. हो रहा है कि नहीं? Able to do?
Yeah.
Able to do.
Sometimes.
थोड़ा सा it's coming. Pay attention अगर knee के muscles tight हो रहे हैं क्या? That means they're trying to help.
Yeah.
बराबर? So see if you are able to relax the knees and do only this glute. This is isolated activation. Only one side. करके मुझे बताओ, everybody in the group, please tell me in the group. Are you able to do one side? Right glute activation, isolated is what we are doing. Legs relaxed, normal breathing, upper body relaxed, only the right glute should work. हो रहा है नहीं हो रहा है बताओ?
नहीं हो रहा है.
अब नहीं हो रहा है?
No, I mean it is not. The leg is coming.
The leg is थोड़ा, see, some little bit will happen because when you tighten this your hip will extend थोड़ा, तो इधर थोड़ा आता है, but बहुत नहीं होना चाहिए. Not able to.
But when the knee is getting squeezed, that is the sign.
We don't want that. Yeah, that's a sign that it's other muscles are helping. This is our body का tendency कि ये नहीं हो रहा है कहीं और से हो जाएगा.
Oh, that my knee is squeezing, so it means नहीं हो रहा है.
नहीं हो रहा है. या मोस्ट लाइकली क्या होगा, इधर नहीं हो रहा है तो ये सब मसल्स टाइट होने लग जाएंगे. They are trying to help.
Isolation activation is little difficult and tricky.
Yes. Okay, now try the left glute. Thighs are getting tight. Now do the left side. We are all doing only left glute isolated activation. Tell me हो रहा है कि नहीं?
Yeah.
अब हुआ?
This is helping.
हाँ, so this one has to calm down. This guy has to understand कि help करना बंद करो, इसको अपना काम करने दो. पर वो कैसे होगा? प्रैक्टिस से होगा और अवेयरनेस से होगा. All our muscles are connected to the brain, ना? If your brain gives the signal and if you focus, then only you're doing it. But what you guys are doing, what most people are doing, टीवी चालू है, वर्कआउट कर रहे हो, जिम में बात कर रहे हो, वर्कआउट कर रहे हो, फोकस किधर है? मसल पे तो है ही नहीं.
activation.
Tell me in the group, left glute is able to activate, isolated. Comments?
Yes. Able to activate.
Able to activate. Good. So now you understood how to isolate and activate. Now this is lying down. Are we doing exercises in lying down? No. We are doing a lot of exercise in standing. Walking may be activate hona chahiye. So let's do this standing. Chalo. Let's activate your glutes in standing. So turn around so they can see back of you. Can see properly? Okay. Now you're going to keep your hands on the glutes and same thing. First, only right glute.
Okay.
Thigh has to be relaxed. Okay, अगर thigh बार बार tight हो रहा है तो knee को थोड़ा bend रखो. So your knee pain could be because one, the glutes are not firing so well और ये thigh extra काम कर रहा है.
Okay.
Could be an overuse pattern for the knee pain.
Correct.
So do this in standing and tell me. First we are doing only right side, activate, isolated. Thigh has to be relaxed, everything has to be relaxed, normal breathing करो. दोनों पे हाथ रखो तो ही समझेगा, दूसरा वाला हेल्प नहीं करना चाहिए. Able to do?
Yeah.
Okay, so you've activated. Tell me if right and left are equal now. दोनों equally activate हो रहे हैं कि नहीं हो रहे हैं?
Now this side is.
Left is not as strong ना अभी भी. हाँ. So what Ashok will have to do? He will have to work harder on the left glute. Now that he knows that, he will have to do more repetitions of isolated left glute activation. You'll do double reps
Okay.
till you feel they are sort of equal.
Equally. Balanced.
Yes, but that is only one part of the puzzle. Ab turn. Now he should be able to, you should be able to, while both glutes are activated, even the abdominal muscles have to be properly activated. सिर्फ अंदर खींच के नहीं होता है. Deep breathing करो, how I taught you. Yes, pull it all in, squeeze your glutes. Good. Now majority of the core muscles are activated at the same time. Okay, your gluteus medius, which is the muscle that sits here on the side, I want you to keep your hand here. ऐसा. And tell me if वहाँ भी tightness आ रही है, वहाँ भी आनी चाहिए.
Yes.
Because that is a very critical muscle that gets ignored a lot. So make sure that one's also activated. Along with glute max, glute med also should be activated. Good?
Yeah.
Okay?
Only right I can do. If I do both together, then I can do it.
Thank you.
Okay, great. So, do we need to pull it up?
I will make a match.
That's all right. PPT is okay now, we don't need. Okay, so this brings me to almost the end of the session. I want to hear from you if you have understood. This was a very small glimpse of, I can talk about the core a lot, as you know. But this was a small way of, in daily life, you should be able to, अगर आप cook कर रहे हो, अगर आप walk पे गए हो, आप ये awareness रखो कि core आपका activated है कि नहीं. That is the first step. How will you build on it? You will do the sequential. And I want you to be an aware person. I want you to be an educated person about the core so that you don't do the wrong exercises, you do them the right way. Okay? So tell me in the group, what was the one thing that you have learned today that you found helpful? Please tell me.
It's very important to activate the glutes and abdominal before starting the exercise.
Yes. And that exercise can be your workouts, it can be running, it can be cycling, it can be walking even.
There are many exercises of core. How many core exercises we can target in a day?
No. So that's a good question. You don't want to do all. So the way that I teach BBC, I take one muscle group. So I'm going to take one day only extensors, and we are going to strengthen the extensors fully till we move on to the next group. Okay, उसका आप circuits करोगे, level 1, level 2 circuits करोगे आप. You remember that from last time. So back to back, when you do the easy to hard exercises for the same muscle group, that's how it gets strong. Then you move on to the next one. Now, which one to start with, that I will decide in BBC, because everybody ka spine is different, right? For you, I know I have to start on your glutes because that's going to help your knee, and that'll give you faster results. But for example, for you, I may have to work with her abs first before working on her glutes, because I know her back. I'm treating her back, so I know that. So when it's individual, I will be able to understand which to work. But if you're doing this on your own, then you have to, one, if you do crunches, I would like you to stop them and do other better things. But if you are doing crunches, please make sure you're doing seal after that. Okay, that way front back दोनों आप अच्छे से कर रहे हो. Yes, at the end when you finish that workout, do few seals, Superman exercises like that activate the extensors also. What else can you do? You can do your activation exercises before your workouts. You can in a day maybe target 2 core muscles and then do cyclically. So every day you don't want to work on the core, but of course if you're in BBC, then every day you will be doing one circuit, and that's how you get fast results. So any more comments in the group? Tell me guys how you thought this was. Again, if you want to be part of the ortho sports community, let me know. I will add you in the forum, because I do at least one free workshop in a month, but I do a lot of paid courses and workshops as well, which are a lot more in-depth and detailed. Next month, I'm teaching a series of 1-hour workshops. If you're interested in that, then I will send you the link. If you're interested in enrolling for the BBC, then I will share a link. उसमें आप आपका details डालो and I will get on a call with you to understand if the BBC is right for you and this is the right time for you. Not everybody will be taken in BBC, because it may not be. If you have acute pain, if you have sciatica type issues, then you may not be ready for it, right? So that I will decide.
Can you explain for the other activation of other core muscles?
So that's actually out of scope for today's. We are almost at the end, but each of the muscles need to be activated separately. Gluteus medius, glute max का मैंने आपको दिखाया, abs का आज नहीं दिखाया, because there are 3 individually हमको उनको activate करना पड़ता है. So if you want, you can come into the clinic and I will check and I'll tell you if I can teach you myself. Or if you're joining the BBC, then of course usme there is a lot more detail. But for this workshop, I wanted you to have a glimpse of what activation actually looks like and how you can step by step work on the core. Questions? More questions? Ask questions if you have. But I'm closing the session now. Jo bhi aapke questions honge, please put it in the group. Today I will answer all your questions. If you have any inquiries about your personal issues, then DM me instead of putting it in the group. And let me know how you found this workshop. I hope it was helpful. Every knowledge, every little information that you get helps you go in the right direction. I hope you never have back pain ever. So, okay, let's close the session. Thank you so much, guys, for being here.
How much is the cost?
I don't know.